Almost everyone buys food, and almost everyone has an opinion on food pricing. When people hear that my research involves comparing the cost of what people usually eat to the cost of a healthy diet, I get this response: "Oh yeah, healthy food's totally too expensive. Have you seen the price of organic kale?" And for those of you on a good, steady income, the price of food perhaps doesn't matter that much. But for those of us without economic security, food cost is a critical factor in choosing what we buy to eat. Our recently developed Australian Standardised Affordability and Pricing Protocol measures the cost of a household's usual diet based on reported dietary intakes from the last Australian Health Survey. It then goes on to measure the cost of a healthy diet based on the Australian Dietary Guidelines. Surprisingly, we found that the healthy diet was around 15 to 20% cheaper than the average usual diet. But what about low-income households? They have less money to spend on healthy food and probably don't consume the average usual diet. Good point. Let's modify the protocol. So I've plumbed the depths of the Australian Health Survey to find out the average usual diet intake of the lowest and other quintiles of household income for a family of 2 adults and 2 children for a fortnight. Then, by using food prices from the stores where people actually shop, I can now calculate the average diet cost by household income. The cost of the healthy diet is of course the same for everybody. And, well, the lowest income households do report a diet of lower cost than the highest income households, but still the healthy diet will be less expensive for everybody. Additionally, a significant portion, around 58% of the food budget, is being spent on unhealthy foods such as alcohol, takeaway and soft drink. This suggests that the junk food industry, with its vested commercial interests, has the most to gain from maintaining current dietary patterns and the perception that healthy food is more expensive. And what about affordability? A welfare-dependent household needs to spend around 29% of its income on a healthy diet, although this does improve with the addition of the JobSeeker coronavirus supplement. So what do we do now? Well, we need to try and keep the cost of healthy foods as low as possible. The exemption of basic healthy foods from GST is a current policy that simply must be maintained. Also, we need to ensure that the most vulnerable have sufficient income so a healthy diet is affordable, particularly in these times of the COVID pandemic when everyone needs help to improve nutrition and stay well. The fact that a healthy diet is less expensive than the usual diet, even for low-income households, needs greater promotion to counter common misconceptions. More also needs to be done to improve food environments and food literacy to encourage all Australians to shift to healthier diets. This will save both money and health.